Hey there, welcome back to How to Medicate and welcome to this new video on how to use Aripiprazole, also known as Abilify. For those I'm meeting for the first time, my name is Raoul, I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because I believe that medically educated people make healthier decisions, which is the whole point of this channel. This video also comes with a quick disclaimer, it's meant purely informative, this is not medical advice, and if you're looking for medical advice, always contact your doctor. And now quickly, let's get started. The generic name of this medication is Aripiprazole, but it's sold under several brand names, among which Abilify, and it's available as a tablet or an injection. Which brings us to how to use this drug. First of all, if you want to use it as a tablet, make sure to swallow it whole with half a glass of water, do not chew on it and do not break it. If you want to use it as an injection, is always placed by your doctor or your nurse in your buttock muscle. The duration of use usually depends on the actual indication and the severity of your symptoms. When aripiprazole is effective, your doctor will probably prescribe it for 12 to 24 months and sometimes even longer. Aripiprazole is part of a group of drugs called antipsychotics, which have an effect on several receptors in your brains, your adrenergic receptor, your serotonin and dopamine receptors. And it is often used to treat several severe medical conditions like schizophrenia and moderate to severe manic episodes in bipolar disorder. Normally I would discuss the correct dosages here, but unfortunately I can only provide you with some guidelines, as these differ a lot depending on the specific indication, side effects you experience and the severity of your complaints. Usually your doctor will start you off with a low dose and then quickly builds up your maintenance dose. Over time, your maintenance dose will be adapted based on the blood levels of aripiprazole you will be having and your symptoms. Therefore, always use the prescribed amount and frequency your doctor gave you. Now, aripiprazole is a very effective drug, but unfortunately it has some side effects. I will discuss the most common ones here, but if you're looking for a complete list, then ask your doctor or check your leaflet. Commonly, patients might experience insomnia, restlessness, anxiety, headaches, fatigue, a dry mouth and erectile dysfunction. And uncommonly, patients experience hypersexuality, depression, a fast heart rate and a low blood pressure. Which brings us to safety. First of all, be careful when combining aripiprazole and alcohol, as this might increase the dazing effect of this drug. Furthermore, be careful when driving your car, as aripiprazole might cause you to become drowsy, sleepy and or dizzy. If you experience any of these side effects, then please do not drive. And lastly, aripiprazole might have interactions with other drugs you're taking, therefore always discuss this with your prescribing doctor. And as always, we end these videos off by taking a look at the safety during pregnancy or when breastfeeding. And unfortunately, aripiprazole can be dangerous in both cases, however, there are some exceptions. Therefore always discuss this with your prescribing doctor. Now I hope you know now how to use aripiprazole, but if you have any questions, let me know in the comment section below and I will do my best to answer all of your questions. And for those of you who want to keep learning, check out the playlist I made in the description or up there. Furthermore, I want to thank my sponsors on Patreon. Thank you Sebastian, who's an investor tier supporter, and thank all of you for watching this video. If you did learn something, please leave a like, this will help out the video tremendously, and consider subscribing, as I'm making weekly medical videos to educate myself as well as you. Oh, and before you go, I recently made an Instagram account at How to Medicate. I'm posting there pretty much weekly, so follow me there for more content. Thank you all, and as always, I will see you next week with a new video. Bye bye.